Please unmute yourself.
Prerak.
Sorry. So, welcome back, everyone. Welcome to World Physiotherapy Day. And I would like to wish all my physiotherapy colleagues, my seniors, my juniors, my friends, a happy World Physiotherapy. A happy World Physiotherapy Day. Today, we have a very special guest with us, Dr. ASHISH Babhulkar, who is a shoulder surgeon, and sir currently leads the department of Dinanath Mangeshkar Hospital. He is also the president and of Shoulder and Elbow Society, and I think he doesn't need any more introduction. So I will straight away go to Dr. Ashish Babhulkar, who has find out some time for our physiotherapy colleagues and our students and enlighten us on some of the very important topics today. So moving on to you, sir. Welcome, please.
Thank you very much, Prerak, and thank you for this lovely opportunity on this very auspicious World Physiotherapy Day. I am wishing all my colleagues happy World Physiotherapy Day, and the amount of work and effort they put in to ensure that the patient is relieved of pain. But not only that, our team physio works towards restoration of function more than anything, and it today is their Just Desserts Day because it's time to acknowledge their efforts.
Sure.
And as a surgeon, I quite clearly understand, and we have invested in physio for a good part of 20 years.
Yeah.
So I know that we are nothing without our physiotherapists. So I'm very proud, and a small section of our team is here. So
Yes, sir.
at first, on Prerak's initiative, I would like to introduce our team here.
Sir.
We have in the green corner, Naneshwar Chaudhary, who's one of our senior most physios, a very accomplished person and a faculty for the PSRP course. And then from Surat, again in green, is Mansi Shah, who does a lot of work in academics and therapy. And so we are very happy and thank you for being there. And we have Prajakta from Mumbai, who's also part of the team PSRP and is a faculty contributor to PSRP. So thank you for coming, Prajakta. And Nikita, who's with us as a team PSRP from Pune. So Nikita and Naneshwar head the Pune physios for the PSRP. And along with that, we have a couple of patients. One, Subhash Saraf from Kolkata. I'm very privileged and I'm very grateful that he took his time out and has joined us from Kolkata just on this occasion to share his thoughts. And of course, Rohit Deshpande will be with us soon.
Shortly. Yeah.
Shortly. So the agenda is pretty loose, and we want to cover up basic tenets of physio because today is not an occasion to go into didactic details of what shoulder physio is about.
Yeah.
Today is a time to share our accomplishments, share our tenets so that we can facilitate your understanding of shoulder. Because come what may, we all agree on one thing, that shoulder is an incredibly complicated joint. It is challenging, and we face a lot of challenges. Although we made and simplified a lot of shoulder rehab, we still deal with some very complex patients. Today we are going to give you a flavor of 3 of these very complex patients, and we are so delighted and privileged to have 3 of these patients with us today, because it is difficult to get the timing, and they are all coming from 3 different continents, and at the same time we have the opportunity to share with you 3 very individual conditions. And of course, Prerak is going to fire at us without any preparation, and we will respond in equal measure. The first introduction before I hand over to Prerak is to introduce and to bring awareness of the fact that shoulder remains a very, very challenging joint all across the world. It is not you and me who face it, but it is important for us to understand and grapple with the basic principles, which is not too difficult. Unfortunately, somewhere in all the noise, we have lost the principles of shoulder rehabilitation. We've tried to simplify it, and PSRP has become fairly popular. And it's not an easy program to master. But at the same time, I must say that if you understand the principles of PSRP, you will simplify and benefit 80% of patients just like that. The challenging patients will require a little bit of experience and often leads to frustration why patients are not getting better. And as we were discussing with Prerak, there are a number of ways to treat shoulders, and across the world, Australia handles them differently. Europe and America handles them differently. But within India, there is so much of diversity where in Kolkata, in Belgaum, in Chandigarh, each one has a different philosophy. And within the city also, there are different streams of thought.
Hmm.
Our mission and my goal would be achieved if we can make a little sense on this and get everybody on the same level playing field to try and understand that these are the principles. We approach these, and then you can build on it on your own individual thing,
Hmm.
because we don't want individualistic treatment. We want what the body needs, what the
Yeah.
biomechanics offers. So the first 3 points I would like to measure is, often patients don't know what they want. They are in pain and they want relief in pain. And there is a lot of pressure on young physiotherapists to get relief in pain. So it's very easy to go into modalities and give them pain, or go into a little bit of acupuncture to get rid of the pain. But I think the three important disabilities that patients have, and often I have to translate English into English for the patients to explain
Hmm.
that the three main things is pain, range of movement, and the strength. And not general strength, strength in two muscles, the supraspinatus and infraspinatus. These are the three targets we have to achieve. On the PSRP, we are very unconventional, very unorthodox, that we disregard pain and we give rehab in pain, because we believe that if you can recruit the supra and the infra, which means that if I can restore the strength of the supra infra in a finite period of time,
Hmm.
it will normalize the biomechanics, it will automatically relieve the pain, and by virtue of that,
Hmm.
get you that third wheel going, is the range of movement.
So,
So achieve these three things, just simplify and understand. And each physio can talk to themselves and say, how am I going to do this? What is wrong in biomechanics? What do I need to restore? So too much emphasis on heat, too much emphasis on stretching to restore movement is not going to yield results. The fact that the cuff got recruited means that the physiotherapist has achieved his goal, and the goal is restoration of
restoration by.
biomechanics. That is important.
So,
There is a fourth goal, which is restoration of function, wherein the basketball player needs to go back to basketball, the laborer needs to go back to his civil work. That's different. That's a later goal, and you can achieve that provided you achieve these first three things. So I recommend all of the physios, the young ones, look for these three things, and then you will start questioning yourself, introspect, and think how you can restore these three things.
sure.
Does that make sense, Prera?
Of course, sir, it does. When it comes from you,
Yeah.
it
Yeah.
makes it even more. So, sir, I think moving on to the next segment of the, first of all, I would like to thank you personally for taking this initiative and agreeing to, coming on our show, because uh, I would say that frozen shoulder or shoulder issues is one of the major bread and butters of physiotherapy. Lot of patients
Mm,
getting into diabetes, lot of patients developing frozen shoulder, and we see so many patients of frozen shoulder right from our OPD in our colleges as interns. But still, there is no specific guidelines for a frozen
mm,
shoulder patients.
mm, mm,
Uh, Very less percentage of us physios know how to have a correct blueprint, how to move forward.
mm,
So exactly, sir, today one of the major points we'll be discussing that from your expertise, trying to understand about the biomechanics and try to understand what exactly patients are expecting out of us, and what exactly as a physiotherapist we should deliver in a given amount of time. So we will move forward to that segment only, sir. So first of all, sir, I would like to ask you, in your experience and as your expertise, what is the commonest of the problems, or what is the commonest of the complaints which frozen shoulder patients come to you, and how exactly we should, approach as a physiotherapist?
Yes. So it is not uncommon in India for a patient to come in late because we are a very pain tolerant country. And over and above that, because this country is economically challenged all the time, our treatment is also always economically challenged. Patients will not realize the deficit in range of movement
Yeah.
and the deficit in strength. Often I would have asked patients, tell me that it's just 3 weeks and my shoulder's locked and it's not moving. And I tell them that it is impossible that their shoulder would be so stiff in a matter of 3 weeks.
3 weeks.
I'm sure this has an antecedent, and maybe you banged your shoulder into something. No, no, I have not had any injury. And then I ask them, have you had neck pain in the past 1 year? Oh, yes, I have had on and off neck pain. And that is the first warning sign. If you can get your patient when he has medial scapular pain, neck pain, that's the time to nip it in the bud. And again, to my friends, that neck pain is heralding a weak shoulder, weak rotator cuff. Don't treat it as cervical spondylosis. Go in and check the rotator cuff in every neck pain patient you have, because that trapezius is compensating for a weak supraspinatus. And if you can pick them up there, you can handle this and restore them back to normal in 3 to 6 weeks flat. Nip it in the bud, pops your ankle. The problem is patients treat it as, oh, I overwork. The commonest thing I get from them, I mean, there are a laundry list of excuses. Lockdown shuru ho gaya, exercise band ho gaya. The commonest thing is, oh, I changed my pillow. The pillow has nothing to do with neck pain at all. We've used the same pillow for a good 30 years now, and suddenly, why do you find the pillow as a victim of, the cause for your shoulder pain? That's number one. Number two is the disability. Typically, you ask your patients, and they will say that I cannot throw the ball, or I couldn't open the car door. I need two hands to open the car door,
Okay.
or I'm sitting in the car in the front seat and I can't reach back. What I do is, okay, I can't reach back, so I'll get out of the car and open the rear door and pick the object and move on. So I have adjusted, but I'm compensating. But those who are fitness crazy will be like, damn, why can't I do that? That's when the penny should drop. But हम लोग वैसे ही लेट लतीफ है कि ठीक है हो जाएगा, नेक पेन है, एज का प्रॉब्लम है, वाइफ मायके गई है, मेरे को घर पे काम करना पड़ रहा है. So this is how we delay things. But if you can pick them up, and a very educated, conscious country will come to you early, because there are less man days lost, less price at the hospital, and complete recovery without any much challenge. But coming back to your question, when you said, what do you do with frozen shoulder? Because it's a big challenge and is diverse. So amongst the cohort of frozen shoulder patients, let's segregate the easy and the difficult ones. The younger ones come in early, who don't have night pain, whose external rotation is 40 degrees, are the good ones.
Yeah.
There is no rocket science there. It's a no-brainer. It's going to work.
Hmm.
The patient who's hypothyroid, and be sure about it, hypothyroid, diabetic, are the ones which will give you a lot of grief. So in which case, you need to spend a little bit more time investigating, assessing, spend more time clinically examining that patient to try and find out, is this different? Because when you see 30 frozen shoulder patients a day, it's very easy to see everybody routinely and, oh, this is this is going to get better.
Yeah.
You want to pick up that red herring there, which is going to give you much more trouble. So your antenna should be looking at patterns, you know. So
Yeah.
when you go to a sabzi wala and you see apples and you say, मेरे को एक 3 dozen apple दे दे, वो सब डालने वाला है उसमें. But an astute
Clinician.
housekeeper, they are much smarter than clinicians. The housewives, they will go in there, ए भैया वो नहीं डालना उसमें, because she's seen the black spot there.
Yeah.
So you need to be a little bit more perspicacious, and that's why in your optimal clinic time, you have little time. So spend more time of that time. 10%, give 10% more to that difficult patient, the person who suffered for 1 year more, person who's had surgery and failed, the person who's elderly above 70. You need to do that. हम लोग सबको 5 मिनट देते हैं. एंड उसमें क्या होता है कि 80% पेशेंट ठीक हो जाते हैं, पर वो 20% पेशेंट्स नाराज होते हैं, आपका नाम खराब करते हैं और फिजियोथेरेपी का नाम खराब करते हैं. So go there and then delve deep, because everything looks like a frozen shoulder, but it may not be a frozen shoulder. So then look at secondary features like, is it a old fracture? Is it a operated shoulder? Is it a malignancy? These are impossible cases. Even Dr. Babulkar can't handle these patients. So they're not going to get better. So no point spending months together in giving physio, which is not going to work. Even then, Dr. Babulkar makes mistakes because of his busy practice, because he thinks shoulder is very easy for him. And once in a while, there's a patient that he's sent to his physios, and the physios come back, "Sir, this is not working. Antenna should go up, and you should have the gumption to dampen your ego and go back. Let me look at it again." And for this same reason, we have a very idiot proof formula that 2 weeks is enough to give results on PSR. And this is a fantastic filter where within 2 weeks, most patients are going to get better. And then 2 weeks are over and this fellow is 10% better. It ain't working. It ain't working. Go back deep, do some investigations, get something done. And so at least you've not wasted the patient's time. You've not spent his money. More importantly, he gets more faith into you because he realizes that you empathize, you understand, and you are probably the one who's going to help him. So these small things actually count and they help. I see too many patients spending 9 months, 6 months doing physio and going nowhere. They feel better for that day because they have done some exercise and they are like clutching at straws. So they're saying, "Ha, theek hai, kal ho jayega, parso ho jayega." But this is a formula that works for everything. You have an allergy, you have a cold, you have fever, you have hypertension, you've got diabetes, you've been on treatment for 2 weeks and your blood reports are showing results. That physician is on the ball.
Okay.
There is small things that count, but we must make them count.
So basically, as a clinician, we should always keep our eyes open and check for the smaller things rather than going into that gross mechanism of things.
Yes.
Yeah.
So there's no generalization. There is no
Yeah.
one treatment for everybody. It has to be individualized.
It has to be custom, tailor made for every
Yes.
individual.
Correct.
Okay. Moving on to Sir Babulkar sir's team. So I will ask you a question. It's a general question for all of you. So working with a eminent surgeon or somebody who sees so many shoulder patients every day. So it's a challenge, it's a good thing, it's a curse. How would you define your experiences? I'll start with Dr. Prajakta.
So no, it's a wonderful experience. Every time we speak to Sir, we learn something new. We might hear him talk about the same topic again and
Again and
again.
again.
Every time we will pick up something new and something different. So and what he says makes so much of sense, so much practicality. It is not theoretical ever what he talks. It's very clinical, very practical. So you have got nothing but a win-win situation if you're working with Dr. Babulkar. That's it.
Okay. Nikita, what do you have to say about it?
Similar, I totally agree with Dr. Prajakta here. I've been with Sir for around 6, 7 years now, and it has been like the best experience of my life. So as she said, that whenever he calls us for meetings or whatever, and he's teaching us something, we are like so engrossed in whatever he's saying, and every time we take home a message.
Okay.
So it's great. Like I love working with him, and day and night we are doing shoulder, but we never ever get bored because, as Sir said, that every patient is different. No patient is the same. Even though we are seeing shoulder day and night, every patient has their own characteristics. So hence, I love working with him. Thanks.
Okay.
I'm going to interject here and I'm going to digress a little. I'm a big fan of Big Bang Theory. I'm sure some of you do watch this.
Yeah.
There's an episode where Sheldon hires Raj Kutrapali, and look at the syntax when these two are talking together.
Yeah.
And when Raj Kutrapali says, "It's a pleasure to work with Sheldon," Sheldon corrects him and says, "No, no, you're not working with me. You're working for
Working
me."
for me.
And you looked at both of these girls, Prajakta and Nikita said they work with Dr. Babulkar. That carries a lot of weightage.
It does.
That is very important that we
Sure.
are on the same level playing field. So that is what counts.
That is what is important.
Yeah,
So,
yeah.
Mansi, ma'am, what are your thoughts on that?
Um, I would just second whatever Prajakta and Nikita has mentioned. And he's always, pushing us to the brim, get your academics correct, pushing us to read articles, keep up with the latest. He will post certain articles in our groups, tell us that, this is something that I've picked up. And I think that's been very encouraging. And he's very hands-on with us. We have any question, he's very approachable. So even if we make a mistake, that's all right. He's there to teach us. He's there to guide us further. I think that coming from an orthopedic surgeon is commendable, because we don't come across many too often where, he's open to discussions and he's open to, talking about the patient as and when, wherever we require. So I think that is very, very important.
Okay.
And
Sure. Thank you. In the end, Daneshwar, what do you have to add?
Yeah. Now I have been working with almost now 13 years, and 2-3 things that I have learned from him is, first thing is time. He is very particular about his time. Even if he is such a busy surgeon, but if you check his OPD time, he hardly gets late for his OPD. So one thing that I have learned is you must respect patient's time. Second thing I have learned from him is he is one of the very few surgeons who tells a patient that you don't need a surgery. He is one of the few and rare surgeons that he give more weightage to rehab and physiotherapy. And out of 100, I can tell you 90 to 95% patients are directly comes to physio. And that one thing is the ethical practice, what we can say.
Yeah. So basically, that tells a lot about Dr. Babhulkar's approach. I don't think we need to go more into that direction. I think we have already what we need. Sir, I think now we will discuss some of your cases, some of your patients whom you have worked very closely, and I think you can enlighten us and our viewers on exactly how did you approach those patients and what exactly happened. Please, sir.
Yes. So let me introduce you Mr. Subhash Saraf from Kolkata, and very interesting case because we found it very challenging. And so I'm again grateful that he joined us today on this, taken his precious time. We gave him only a last minute notice. Basically, very briefly speaking, he's about 64, I think. Am I right? So Subhash Saraf?
I'm 59.
59, sorry, 59. And he's had pain for a good part of 8-9 months. He approached us online a few months back, and we did a video consult. And there were constraints because of the lockdown that there was no way to examine him perfectly. So he had a few investigations. He was being treated by a few surgeons previously, and I will ask him to detail on that. My only job is to tell you that he had a lot of pain, and this was worse at night, and there was no particular injury that I remember. And we advised him to send his video CDs to us. So because I don't trust MRI reports, because he sent all his reports and MRIs, and they can often be wrong and misleading. So we don't give any weightage to MRI reports. So he sent his entire, he actually uploaded them. We didn't get those because they couldn't decipher. So finally CD came after a longer delay. I saw the images myself, MRI images, because we prefer to do that. And I decided that he had a small minor rotator cuff tear. A minor rotator cuff tear doesn't harangue me at all. So I will now ask Subhash Saraf to detail his history. And once we have done that, we'll take Rohit Deshpande's case.
Please.
Thank you, doctor, and I wish you everybody a happy World Physio Day.
Thank you, sir.
And
thank you so much.
With so many physiotherapists around here, and with Dr. Babhulkar, it's something like I also in my profession speak at various forums as a chartered accountant. It's something that as a patient I have to share my experience in the doctor fraternity. So it's a rare opportunity. So thank you, doctor, once again. Let me tell you very frankly that I also don't remember if I had any injury in my left shoulder, but around 20 years back, I remember I had it should be 20 or maybe 18, 19 years back when I had some pain in the shoulder. And that point of time, I went to Mumbai. Dr. Sanjay Govilkar, if I rightly remember, or Sanjay Divakar. Then he treated me and he only gave me some exercises and one injection I remember at that hip point of time. I even don't remember it was in left shoulder or right shoulder. So I didn't have the entire file anything with me. But all said and done, in last 6 months, I had gradual pain. I was a regular to gym at least 3 days a week. So when I was weightlifting, so from the right hand, if I can lift 5 kgs, with the left hand, I could not lift even 2.5 kgs gradually. So my personal trainer sometimes said, okay, you don't lift it, then he massage something, and then my pain used to go. But during the lockdown period, when it started around last week of March, then when definitely maids were not there, servants were not there home. So I had to help my wife in doing, my parents were at home. So definitely we are not, I'm not used to do chores. So of course it was not much, but then still it was from nil to something if you have to do. On a scale of 1 to 10, I have to do 0 to 5. It was good work for me. So the pain increased. Then Calcutta, all doctors were locked down. I went through one of the best doctors in Calcutta. And when he said first time on 4th of May, I was regularly interacting with him. And the same day, he got my MRI done and got a couple of tests done. And immediately he said that, okay, आप मेरा personal clinic में शाम को आ जाओ, and after doing this MRI, because MRI people immediately send him the report. So he said शाम को आ जाइए, एक को थोड़ा सा आपको इंजेक्शन देंगे और कल 2-3 दिन सर्जरी करवा लीजिए, नहीं तो ये ठीक नहीं होगा, it will take long time. और आपको कुछ लेना है तो पेन किलर दे दीजिए. जस्ट ही रोट ए पेन किलर, ही सेड रात को लेके सो जाइए, अभी 2-3 दिन 4 दिन आपको वेट करना हो तो करिए, बट यू हैव टू डू इट. Somehow the other, I didn't got convinced. I took the pain killer 2-3 days and I applied Volini spray in the night, but the pain kept on increasing. Then I again went to the next doctor. Again he's one of the reputed in Calcutta, again a surgeon with 30 years of experience in one of the leading hospital of Calcutta. He again immediately checked me because he was in PP suit and all, because at that point of time COVID was at a very top. And immediately 2 मिनट में देख के वो MRI देख के बोला नहीं कुछ भी नहीं है, गया आराम से जाइए. He gave me 3-4 kind of medicines, one muscle relaxant, one that. Immediately he recommended a physiotherapist who came to my house and gave that electric shock for 4-5 days. And exercise he stopped. He said अभी कुछ exercise नहीं करना है. And when the electric shock was given, my pain subsided for 1-2 hours, and then again it increased. I kept on telling doctor that should I come and see you after 4 days, 5 days, 7 days. And he again, after 7 days, he did consultation and repeated the same thing, just to change one medicine. But it did not subside. Some of the other, the 20 years back when I consulted one doctor, then that doctor has become again a head of orthopedic in one of the again leading hospitals chain of India, which is in Calcutta. And he said, Shubha sir, बहुत दिन बाद आपसे मिले हैं, कोई बात नहीं, तो अभी तो online consultation करेंगे. Because my sister used to go to him and he said that, Dada bhaiya, वो doctor has come back to Calcutta. Earlier he went for a foreign country to some training and all. आप उसको दिखाइए, he is better. I remember that he only recommended me to the Bombay doctor. Then I said, okay. And he immediately said, why are you moving your hand for last 2 months? If you have pain, you should close your eyes. The one is वो बेल्ट वेल्ट सब दे दिया मेरे को, सब बंद कर दिया ऑनलाइन कंसल्टेशन करके. For 5-7 days I was sitting in a lockdown period without moving my left hand. Then he gave another feta, and then कोई exercise नहीं करना है. And then again he gave me 4-5 kind of medicine. When I saw the composition of both the doctors' medicine, the composition were almost same, only the company was different. They have 2 kind of painkiller and muscle relaxant and one basically vitamin. Then came something as a surprise, that when I in my family group is there, when I posted my photo with that belt and everything, and they said, "Hey, क्या हो गया आपको? क्या हो गया?" Then my sister stays in Malegaon, so she was consulting to Dr. Babulkar or in Dhyanath Mangeshkar Hospital for her knee pains, Sunita. Then my niece said that, Mama, you can once talk to Dr. Babulkar, and he is a shoulder specialist of all India repute. And so please see. This is how I came in contact with Dr. Babulkar. And immediately I got an appointment, and immediately the medicine started. And since on the basis of report, he said, I need your images. Somehow the other, for 1 month, the images did not reach him. And of course, there was a slight relief in pain because Ganesh started with exercise on a very good note. I think 14 days I continued with Ganesh continuously. Then I think he reviewed for every week. Around 5 weeks went, and I think again
These
second.
were online exercises.
Yes,
Yeah,
sir.
yeah. These all were online exercises. And then almost 2 months passed off. He kept on telling doctor, pain is not going, pain is not going. But doctor had been very patient. All the three occasions when he consulted me, including the first one, he was noting all my movements, and he was recording data on the system, which I never saw in any of the Kolkata doctors which said they. Even when I went for twice and thrice, they were just saying, "आप हाथ उठाइए, आपका ठीक है कि नहीं हाथ?" I said, "Okay, हाथ उठाइए." Then they never asked me to say right, left, or angle, degree, and I could see that he was mentioning to the yogis that to note down 30 degree, 40 degree, 50 degree. I mean, whatever be the technical words. So I could see that there is a scientific way had been devised by doctor himself that okay, how a person can be measured. Maybe it was online also. When at the end of 2 months, when it was not subsiding on a scale of 0 to 1, 0 was the maximum pain. So say the pain reduced, say 0, say it was not better to 3 or 4. Then I talked to a doctor. He said that I need to see you once if it's possible. You can come down and I'll give you an injection. I requested doctor, if you write injection, I can take it in Kolkata. He said, no, it won't work. Something hit my mind that because post-injection doctor said that you have to be here in rehab, if local 14 days, if not local outside, we keep for 6-7 days. And 6-7 days during the COVID time was a nightmare to stay, because hotels are not allowing, family will not allow to stay in hotel. How can I tell doctor that and in hospital also I can't stay, because I never stayed in a hospital in time in my life. First time I've gone through this kind of a treatment in my 59 years. First time I have fallen sick, I should say. So then I just talked to the doctor and I got a ticket because the Calcutta Pune flight is not operating. So I had to come through Hyderabad. My goodness, the flight was full. I had to pay 20,000 for reaching Hyderabad, Pune. Coming back, I had to pay 18,000. And the flight was full with laborers of real estate workers, because all, I think, real estate companies are flying the workers to the flight. And only I think you can say that of a business travel or patients were maybe 10, 20%, 80% were the laborers there. So it was a scary flight, in fact. So we took our care and do. When I landed up, my first gratitude to the doctor that it was perfectly on time. None of the department wherever I visited for X-ray or maybe sonography or anything, I had to spend time. And within 2.5 hours, I was out of hospital. That was something miraculous, that after so many things, including my injection, physiotherapy, I think it may be 3 hours. Even before lunch, morning I came, and before lunch I was at home back. And after the injection, I had good pain to the entire night. And doctor said that आप यदि 6 दिन यहाँ रुकते हैं तो बहुत अच्छा होगा. And I said, sir, doctor, how to stay back? I went home and talked to my wife, talked to my children, and then talked to my sister, who was my nephew was staying at Pune at that point of time in the PG. And he said, Mama, you can stay in my room and we can accommodate. And it was torrential rain in Pune at that point of time, and didn't carry my clothes on just one cloth, and it was wintry kind of an atmosphere.
Mr. Saraf, can I stop you there?
Yeah.
You tell us that we gave you the injection for your stiff shoulder, which was, I have to translate that to everybody else, that this was not a steroid injection. It was a normal saline injection to restore his external rotation. So we call it the HVI, high volume injection. And so after the injection, what happened? You did your 6 days. We want to understand, did 6 days of physio help you? You did them twice a day. What kind of impact did that bring?
So the staying back of 6 days was a blessing for me, I should tell you, because if I would not have stayed, my posture would not have got right, because online physio I did through Ganeswar and Dr. Himani. I think her name is Himani. So both the doctors were doing very with extreme care. But when I went to the doctor's rehab center personally, and morning, evening, when I did the physio, I think instead of half an hour, I did it for 1 hour. So very slowly and with very personal care with the doctors. A morning, I think one doctor did, and in the evening, one doctor did. In the evening, I don't remember name, Neha or something, and in the morning, Ayushi. And the first day, Himani did it. So Himani went did so online, and when she guided me personally, it was hell of a difference. So first and foremost, that personal going to personal care and doing physio under personal care makes a lot of difference than the online physio. If you had have done
If I have to ask you, Mr. Saraf, you've done a lot of treatments in the past. In the 6 days that you did, uh, how much was your pain reduced?
yeah, when I landed at Pune, say it was at on a scale of um, if my pain was at 3 4 better, it improved to 6 7
6 7.
with
And
the
then, how much did your movement improve?
doctor. It movement improved to double. Whatever I came to
Double.
Pune, almost
Yeah,
double.
double. And are you taking any painkillers?
No, only painkiller I took for the first 4 5 days, mentioned, which you prescribed me. On the 6th day, when you checked up and you just crossed it, so it is just crossed. I have not taken any painkiller
Super.
till date.
Perfect.
Great.
Perfect. So, for want of time, Mr. Saraf,
Yes.
there's a lot of pressure on time. There are two other patients,
Yeah.
but I'm going to succinctly conclude what Mr. Saraf benefited here, that he's a patient of a partial cuff tear, and these are challenging patients. Giving physio in the presence of tear is difficult.
Yeah.
Number one. If it's a full thickness tear, we have no hesitation in offering
Of
surgery.
choice is
And all full thickness tear patients deserve surgery. We are not appropriate to give rehab just like that, by and large, as a thumb rule.
Hmm.
But because he had a partial cuff tear, which was incomplete, I think he deserved a trial of exercises. As today, just now, what he has reinforced and exactly said what I mentioned on the introduction was that you must be able to give results in 2 weeks. In his case, we gave them in 6 days, but in your hands, 2 weeks is fair enough. Number two, we didn't rely on painkillers, and his restoration was in movement, pain, and strength. So, if you can achieve that in the first 6 days, 2 weeks, then you can ask him to continue on his own, and then they will progressively get better. And if he had not got better, then we could have got step back and gone through that.
Yeah.
The last point I'm reiterating again is, do not give credibility to MRI reports. His MRI reports have mentioned tear. His first surgeon had advised surgery. So this is what is important, basics. And we mentioned basics, and he's a perfect test case that the challenge here is pain, stiffness, and a tear. But it's a partial tear. So that is how it works. Thank you, Mr. Saraf. We are
Thank you, doctor.
very
Sure.
grateful.
Thank you, sir.
You
Thank you for
shared
your
your honest feedback,
Thank you.
and it's important that we take all the good things from his, and we are happy to change.
Thank
Let's
you, doctor.
quickly move on to Mr. Rohit Deshpande, who's here with us. Thank you again, Rohit Deshpande. I'll just briefly uh, give his history, and then I'll let him take over. He'll briefly highlight what happened to his shoulder and did he get better or not. He's a different test. He's an operated patient. So we are giving you a different flavor here. He had a cycle accident, a nasty cycle accident a year before he saw me. And this was in the US, and he fell badly, bruised badly. He messaged me from there, and he's a dear friend. And I said, don't worry, it's an early injury. And slowly he recovered as well. But his pain just wouldn't go away. He's an avid tennis player. For the longest I have known him, he's been a sports person, and tennis is his passion. And so we knew that he's a player, and it was unfortunate. It was heartbroken. And when he came to me much later, because he couldn't bear in his pain, I diagnosed a ligament tear. He had a posterior labrum tear, and obviously it needed surgery. But Rohit is around 54, 55, and he's a businessman. His day job is not tennis, so that doesn't have to be respected as much as his job and business has to be respected. He had a large glenoid lesion on the posterior entire wall of the glenoid. And that threw me off, because in the presence of cartilage damage and a labrum tear, you're torn between the devil in the deep
The-
sea. So it was difficult to address both of them. Did he need a replacement? Did he need a repair? The risk was I repair it and he becomes stiff and it will not work well. So there's no challenge in repairing him. But the problem was it came with a lot of baggage.
Baggage, yeah.
So like the same principle with Mr. Saraf, we gave him extensive rehabilitation. We brought him out of the disability. We restored his movement. We restored his strength, but his pain wouldn't go away. And from here onwards, he will take over. I will let Rohit describe his scene.
Thank you for
Rohit.
joining us, sir. Please.
Yes, hello. Okay, I mean, the thing is, I had a nasty fall in the US. But before that, I have been playing tennis since I was in the 8th standard. So I have played tennis for 40 years until the 6th of May 2017. And I flew to the US on the 6th of May. And on the 8th, as I was cycling in Oregon, and I had a nasty fall. And it was really nasty. When I got up, the pain was so excruciating. And I didn't know what to do. And my wife was also with me. She's a doctor too. And she is Dr. Ashish's classmate in Belgium. They did MBBS together. So Dr. Ashish has been a family friend. So the thing is, 5 minutes later, I just, from the US, my wife called up Dr. Ashish and asked him and narrated the whole incident to him. And she told him that, my elbow was also bruised, my knees were bruised, I had a very bad fall. So Dr. Ashish just told her, she asked Dr. Ashish, should I go and see any orthopedic surgeon in the US? So Dr. Ashish, I still remember that he was so firm about it. He said, "Kuthai जाऊ नकोस दुसरीकडे." He just asked me to take an ice pack and treat myself with the ice pack. And he gave me 1 or 2 painkillers, which were the OTC medicines, which were available across the counter in the US. So I was there for the next 7 days. 8th day, I flew into Mumbai. From there, I had asked my car to come and pick me up. Straightway went to Dr. Ashish at Dinanath Mangeshkar Hospital. He saw the whole thing. He has explained what has happened after that. I will come back to I was surgically operated. After the surgery, here Dr. Ashish asked me to come to his clinic at Pune for the physiotherapy exercises. I went there. I diligently did I was there for 5 days, sorry. And Nyaneshwar was there, and I don't remember the doctor's name. I mean, she also, the physiotherapist's name, she also helped me. And that was after a month after the surgery. And I immediately, after coming back to Belgium, I started doing the exercises twice a day.
Yeah.
In a month's time, that was, I was operated on 27th August, last 27th August. I started the exercises in October. By Jan 2020, my pain had subsided by almost 80-85%.
Oh, great.
And my movements were also pretty free, and I was very, very comfortable. But what happened was, with that, I think I became a little bit more overconfident. And I think I started doing the exercises. I wanted to finish because, it was 3 months of those exercises twice a day. I got bored. And I wanted to finish up the exercises fast. And I think in that haste, I think I had some wrong movements or something. And pain just came. One day I was exercising. it gave me an excruciating pain in the shoulder, and then after that the pain returned.
So
I immediately called up Dr. Ashish, I told him that this is what has happened to me. So he said, stop your exercises for 4 or 5 days, and he suggested me a painkiller.
okay.
Believe me, after the surgery, after the Pune visit, until then, I was not at all on any medication.
Yeah.
I was only on the vitamin tablets which Dr. Ashish had prescribed. No painkillers, nothing. So I was so happy with the PSRP the exercises that were suggested to me.
So
But this pain was so nagging, and it was really depressing, because I thought that in another 15 days I would start playing tennis. And 1 month I just neglected it. I said, जाऊ देत, बघूया आता काय होते ते होते. Let nature takes its own course. But it wasn't helping me. In the meanwhile, the COVID set in, the lockdown was announced, and I remember it must be on the 26th or 27th of March that I called up Dr. Ashish saying that, Ashish, it's unbearable, please help me. And I can't come to Pune, what do I do? So Dr. Ashish, with a twinkle in his eyes, said, Rohit, don't you worry. We have started online physiotherapy sessions, and he put me through to Dr. Himani. Hello?
yes, sir. You're audible, please.
Yeah. So he put me through with Dr. Himani, and I did a 14-day course with Dr. Himani. And on the 7th, 6th, and obviously I had done the things wrong, because when Dr. Himani told me online, there were so many mistakes which I was doing. She corrected all those mistakes. 7th or 8th day, I had a 50% relief. And after the 14-day course was over, again, I called up Dr. Ashish. I told him how good the development has been. And he said, Rohit, you please continue doing those exercises. From March until today, I have been doing the exercises relentlessly. In between, for 4 or 5 days, Dr. Himani again joined me, because she wanted to ensure that I have not taken I'm not wrong postures or something like that. So she helped me again in between on 1 or 2 sessions again of 4 days each. But she was this time she was sure. She told me that you're not making any mistakes, and I too realized it, because the pain was subsiding day by day. I'm doing the exercises twice a day. Not a single pain. Dr. Ashish has prescribed me Etoshine. He said, if the pain recurs, or sometimes if you are uncomfortable, take Etoshine, but Etoshine 60. But till date, maybe I have taken it once or twice, because I don't know why that pain was there, but I'm absolutely so comfortable. I could say I'm almost 90% fit.
That's great, sir. So basically, Ashish sir's treatment and along with that physiotherapy, so it worked beautifully for you. And now
Excellent.
I would say you are 90% pain free. So that's very
Absolutely.
good to hear, sir. And I think now we'll move back to Dr. Ashish, and we'll try to understand what exactly was the process. How did his team manage plan for both of these patients? Yeah, please, sir.
Yes. And I would like to hear when Dr. Ashish says, Rohit, go back and play tennis. I'm waiting for that day.
Sure, sir. It'll come soon, I guess.
Well,
Yes, Dr. Ashish.
there's a large bribe to be paid before we do that. But both these patients are not your normal patients. They are not the typical Joe Blacks that we see, where you do the rehab and you restore them. Both of them have deficits, because they have had one of them has a partial cuff tear, which works against us. And Rohit there has a cartilage damage, which can be a tremendous obstacle in restoring function.
Yeah.
But The important point and take home I would like to give all our colleague physios here is the PSRP is designed as a deficit based approach. And that's why we decided that we should individualize treatment. It should be bespoke. So check in your patient, what is the deficit? So in Mr. Saraf's case, there's a partial cuff tear. There was a lot of stiffness. He couldn't do his external rotation. If you don't have an external rotation, then you don't have an excursion to play your bands, exercise bands. How are you going to restore the balance between the external and internal rotator?
Yeah.
So we realized, we gave him a trial and it didn't work. And his external rotation was predominantly stiff. The rest were improving. And so because we were measuring, and he made a very nice point there, that there has to be a metric. You can't just say that patient said my pain is 50% better, so he's 50% better. So we use a UCLA score so that we know exactly how much our intervention has helped. And so we gave him an HVI injection. The moment we give that injection, it's just normal saline. We restored his range of movement from 0 to 45.
Okay.
Allowed our physiotherapists to kick in. So a lot of people injections, we use the injections rarely, but if we do, we use them as a means to achieve our goals, which is the goal remains physiotherapy. The goal remains PSRP. So the injection is just a means. It is absolutely disingenuous to give an injection, give him relief and leave him be, which is what most injections would do. Whereas you use that opportunity and then restore the biometrics with the help of that injection. Rohit's case, because there's cartilage deficit, we have to restore his biomechanics, work on the scapula. The other take-home point that I would like to tell your physios is when you've done everything and it's still not working, just go back and work on the scapula, stop everything else.
Okay.
In 8 out of 10 times, that is what is going to work. And most of us don't give scapula its due. The scapula is the core, it's the most important base of that shoulder.
Okay. Okay. Moving on to Dr. Dhyaneshwar. You have been working very closely with Dr. Ashish Babhulkar. You yourself mentioned it's almost 13 years. So what is the sort of process, if I may ask you, what is the process which you go through once a patient, a frozen shoulder patient approaches your clinic or he approaches you as a clinician? So what is the, just guide me through the process, how exactly it works there.
Okay. So once the patient comes, we, as I said, we again check and note down his range, strength, and pain factor. Okay, because these are the three goals which towards we are going to work. And then after that, we start his physio. Now here, I would like to tell, we use exclusively PSRP program for our shoulder patients. We don't have any modalities or any generic physiotherapy equipments except electric stimulation. So the program is designed in such a way that the patient comes for 2 weeks. That is a supervised program, and in that 2 weeks, our goal is to get that patient at least 40 to 50% better. Okay. Yeah. And so on first day, on 5th day, and on last day, we again evaluate that patient, and that is how that program works. But in between, on 7th, 8th day, if we feel that the patient is not recruiting his cuff muscles or his pain is increasing, then we step back, we again reevaluate him, what is wrong that we are going or we are making any mistake. If we feel that we are correct, but still that patient is not, that program is not helping, then again we send back to that patient to sir for reevaluation. But that hardly happens because his clinical diagnosis is so perfect that that situation arises very
it's very often. Yeah. Okay. I'll ask next question to Dr. Nikita. Nikita, because you're based in Pune and you've been working very closely with Dr. Ashish Babhulkar and you're working on the PSRP program as well. So if I, as a layman, ask you, what is the average duration of recovery and how soon can you relieve me out of my pain and my frozen shoulder? So what is an answer which you give to a patient?
Yeah, thank you for the question, first
Please.
of all, and good evening to everybody who is attending the webinar. Thank you, Ashish, sir, first of all, for giving me this opportunity today. So let's discuss a bit about the duration that is required for the recovery of a patient. So I would say, according to the protocol that we follow, it would take an average of, say, 12 to 16 weeks for the patient to recover to near recovery or near normal, we can say. So it may be a little less, it can be a little bit more. It depends on a lot of factors like
Yeah, of
age,
course.
the comorbidities and etc. All. But there are particular two factors which I would like to discuss a little bit more in detail. The first one being patient compliance. So many physios here may have experienced this, that when a physio comes to you via an ortho or via some reference, the first question he will ask you is, ये exercise कितने दिन करने पड़ेंगे? So that is like a very common question. They take it as a task कि ये exercise कितना दिन we have to continue. We agree that the patient has suffered a lot and he's been in pain for 3 months, 6 months, whatever, but the patient needs to understand the pathology, what is exactly happening in his shoulder, what exactly we are going to do, and how it is going to help him in the long term, especially patients with diabetes, thyroid issues and stroke, Parkinson's. After this, the shoulder does become more stiff. I mean, they're more prone to all this, so that's why they should be educated properly about all these factors. Secondly, being the stage. So which stage the patient is of
Yeah, that is very important
yeah,
actually.
yeah. So most of our patients come to us maybe in stage 2, which is like the freezing stage,
Freezing stage, yeah.
when the stiffness begins to increase. The pain
Increase.
is not much, it is there, it is not much, but the stiffness is there. So that is when their daily activities get affected. They cannot comb their hair, they cannot, wear their clothes properly, they're not able to wear their belt. So they have these issues going on, and that is when they know that something is wrong and I have to meet the doctor now. So that is when they come to us most of the times. So we all know the earlier he comes, the less stiff he's
The
going
less
to be,
stiff is, yeah.
obviously.
Yeah.
So in some cases, local corticosteroids, like Sir said, HVI may be required. It's not in all cases, and it's required only to reduce the inflammation. It's not as a treatment. It is just going to help the patient, exercise better. That's the reason we give it.
Yeah.
So in our PSRP protocol, what we do is, in the 2 weeks of supervised program, by the end of 2 weeks, the patient tells us that he's almost 40 to 50% better, like Nyaneshwar sir said.
Yeah.
And usually on the 6th or 7th day, if a patient with night pain is coming to us, on the 6th or 7th day, he will tell you that कल परसों तक मैं 1-2 घंटे सो पा रहा था, अब मैं 4-5 घंटे continuous सो पा रहा हूँ. So that is when we know that
So the night pains have decreased.
yes, they're able to sleep for a longer time.
Yeah.
So then they know that they're going in the right direction. It's working. It's like a boost of confidence, for the patient as well as for us. And
Yeah.
the patient is more willing to do the exercises regularly. And as sir already mentioned, that they keep a regular follow-up with us and with him monthly till he gets better. So I tell all my patients, none of you, sir आपको छोड़ने वाली नहीं है जब तक आप पूरी तरह से ठीक नहीं हो जाते.
Okay.
Going to keep a watch on you till you get, completely okay. And in very, very rare cases, a capsular release may be required.
Yeah.
So it's not for everybody. It's an option. A patient is not getting better for 3-4 months, then it is thought about. But
Okay.
otherwise, we don't think of, arthroscopic surgery for a patient with adhesive capsulitis or a frozen shoulder, normal one. So as I mentioned earlier, 12 to 16 weeks would be a good duration, for the patient to recover completely, in my experience.
Okay.
Okay.
Sure. Thank you. Thank you for that answer, and thank you for taking out time. Next question I would like to ask Dr. Prajakta. Hi, good evening. Welcome to our show. And everybody has been speaking about the fact that pain and exercise, they go hand in hand. But don't you think that's counterproductive? How do you manage such cases? Because in my opinion, and in generally how the population thinks, if there is pain, they will not allow you to go through the exercise. And if exercise is not there, the pain is surely going to go over. So how do you suggest, how do you manage such cases?
I would say no gain without pain. But no, having said that, I think pain is a good thing. It is your body's way of telling you that something is not right. Something needs to be done because this pain is there. So when a patient comes to you as a physiotherapist, it is your responsibility to first figure out why the pain is there. So say for example, a patient has come to you with tennis elbow. So you need to go and dig deep, not just look at the elbow, but look at a joint above, a joint below, and figure if the pain is originating from that particular point, if it is arising from the shoulder. Say a weak shoulder could be causing a tennis elbow. The weak supinators may be causing a tennis elbow. So first we need to establish what is the root of the cause. Once we establish the root of the cause, we need to start addressing the root there and there that particular day. So agreed, the patient might have a lot of local swelling, inflammation, pain. That does not mean we wait for the pain to go down. We will just do probably a soft tissue release, or we do ultrasound and then maybe ask the patients to take a few painkillers and then go back, rest for a week. Once your pain settles down, come back to me, then we will exercise. No, I feel that's an absolutely wrong approach. We first need to, if we have established that the pain is, say, suppose because of a weak shoulder, let's start addressing the shoulder right on day one. If you address the cause, the subsequent victim, which is the elbow, is of course definitely going to get better in any ways. You can use your other modalities as an adjunct to your exercises. So I'm not completely writing them off. So you give your ultrasound, or you could ask the patients to take certain medications very rarely if the pain is really intense, to take those medications, but you start exercising. So it's not that if you exercise, if you move that joint, it's going to create pain. No. In fact, exercising is going to reestablish, it's going to form the neuromuscular pathways. It is going to rebuild the proprioception that has been lost. So in fact, most importantly, it gives a sense of well-being to the patient. Okay, fine, I can move. It's not that I need to be completely immobile. So I think, in fact, pain and exercises, they go parallel to each other in the opposite direction. So as you start exercising, your pain is going to reduce. So it's very important that you start exercising from day one. Again, as a physiotherapist, you need to use your expertise, your discretion. There will be some cases wherein exercising might be difficult. Like say a patient with an acute calcification comes to you. So they might get up in the morning and they are like, I'm just not able to lift my shoulder. It's like a pseudo paralysis of the arm that they get. Now, in these cases, you don't want to give them a TheraBand and ask them to, okay, no, start doing this exercise. Of course not. So you being the expert, you need to use your expertise, you need to use your discretion, and then decide whether you want to give it or not. But in my experience, 90 to 95% cases, you need to start exercising day one. If it's a case of frozen shoulder, don't start working on the range. Okay, let me first get the range. Let me stretch the patient. Once the range comes, I will start with the exercises. No, start the exercises, restore the biomechanics. The pain will go down, no doubt, but your range will anyways automatically is going to improve because you're restoring what is wrong. And you're not locally looking at a particular problem. So once you focus on the entire problem as a whole, holistically, if you approach it, definitely exercises is the option, is the answer rather.
Sure. Thank you, ma'am. Thank you for your this thing. And now I'll be taking I think the last question for today from Mansi, ma'am. Ma'am, it's somewhat different from what we are discussing right now, but generally a lot of people in our fraternity who are working with athletes, who come up with shoulder injuries. So a lot of people ask us, what is criteria to get back to the sports, or what is the criteria then you can allow these people or these athletes to train the way they were? See, because when they have lost a lot of time during the pain and during the injury, so what is the go-to back criteria for returning to sports? Can you put some light on that?
Yeah, so firstly, what I would like to say is, there are several protocols that have evolved over time. We have a lot of protocols given by Kevin Wilk or Dr. Andrews, which have been published, and each one has its own time frame. There are a lot of factors that one needs to consider. Firstly, are we talking of players who are amateur players or who are professional players?
Professionals, yeah.
Yeah, so that is one thing that I would look at. If I'm talking of a conservative patient or I'm talking of somebody who's operated. If the patient is operated, am I looking at an open surgery or am I looking at an arthroscopic surgery? Also, the willingness of the patient to go back to sport. How confident is the patient to return back to sport? So I think there are various factors that one needs to understand before we put them through a set of exercises to return back to sports.
Yeah.
But the most imperative thing is that one needs to remember the return has to be safe. It has to be graduated. Person needs to progress from one phase to the other. You cannot tell the patient that, suddenly let's start doing these exercises and you can go back to playing. No,
Yeah.
it has to be a graduation program. So you graduate the patient from phase 1 to phase 2 and then phase 3. So as Prajakta mentioned that, you start exercising, you start working on the basics, start stabilizing the scapula. Once the scapula is set in, you start recruiting the rotator cuff. You progress the exercises with the TheraBand.
Yeah.
Start adding proprioceptive drills for the patient. You work on the neuromuscular control, because at the end of the day, that is what you want to achieve. Once the neuromuscular control and proprioception are better, the scapula, the dynamic stabilization is improved. It is only then would you ask the patient to return back to sport. I cannot have my patient aim returning back to sport unless I have worked on these functions.
Yeah.
So once I've worked on these factors, most importantly, it takes about, each phase has its own time. So first 6 weeks, if it's an operated case, is the healing phase. It's a protected phase and not much exercising that you're
Exercises
asking
can
the
be,
patient to do. The next 6 weeks are going to be supervised exercise protocols, where you are calling the patient. The exercises that you're giving the patient at this point of time are basically scapular stabilization and rotator cuff recruitment. Once you've done them, the patient is working on the core muscle simultaneously, because as we all know, our body is a kinetic chain. And once you want to return back to sports, your powerhouse needs to be strong.
True.
And if you're talking of sports like cricket or throwing, anything that involves throwing, or are we talking of collision sports? The criteria for returning back would be different. So if I'm talking of an overhead athlete, I need to see to it that the joint is put in a position where, you have a lot of overhead throwing. I need to have good external rotation. I need to have good abduction. I need to have excellent external rotator strength. Or as against to that, if I'm looking at a person who needs to return back to collision sports, the patient needs to have strength, power to be able to sustain the load, to sustain the impact that he's going to have through.
Yeah.
So depending upon a lot of factors, the patient will go back to sport. So on an average, about 12 to 24 weeks, you start training them for phase 3, where you concentrate a lot on PNF techniques. We use the D1, D2 flexion extension protocols. We go from static to dynamic stabilization of the scapula. We would introduce the YTWL exercises for the patient. We see to it that the lower trapezius is now strong enough. So, you sustain from 1 to 2 to 3. And then eventually, once the patient has achieved enough endurance, enough power, enough range of motion, we start sport-specific training.
Yeah.
So if I need somebody who needs to throw the ball, I would gradually, introduce an interval program to the patient. You're not going to throw 100 balls on day 1.
True.
You would give them a graded protocol. So, throw a certain set of balls on the first day, gradually increase, give them rest in between. First week, you're only throwing once a week, then you gradually increase the program.
Yeah.
So if I have a tennis player, I would start with knocking below the level first, start with forehand and then shift to backhand and then go to overhand. So, graduate from one step to the other.
Yeah.
So I think that's the best thing to do. And one needs to understand that each sport has a specific pattern that one needs to go to. Even if it's a cricket sport, if I'm a bowler or I'm somebody who's going to bat. So depending upon that, my requirements and my strengths need to be judged and accordingly add on. So if I'm going back to a racket sport, probably add the racket or the grip to the patient while you're working with them in the clinic. Give them that added leverage while they're working. See to it that the grips are correct. You need to work on the grips as well.
So more of a functional approach.
A functional approach. It's a holistic approach. You're not only going to look at the shoulder, you're going to look at the entire kinetic chain. You are going to also give them a phase 3 core exercise program. Go from stable surfaces to unstable surfaces. Challenge them more. Go on to plyometrics. Use the medicine ball if need be. Use the plyo, the plyo surface that you have, the plyo ball. So use things like that. before they return back to sports.
Great. Thank you, ma'am. That was quite enlightening, actually. So,
Thank you.
moving on to Dr. Ashish. Sir, I do realize that shoulder is a very complex joint, and one whole shoulder cannot be covered in just one small session. And there is a lot to teach and lot to learn. So, if all our viewers are looking at this uh, telecast right now, and you would like to give him some take-home points that they might not know what needs to be done, but if they understand what we should not do, I think that will be more of a, adding some value to the lecture.
Yes, Prerak, I agree. As I said at the start of the webinar, that there are many means to, uh, with many ways to skin a cat, for want of a better phrase. Uh, Whatever floats your boat. So you could use slides, stretches, whatever you do. The PSRPs are rock solid, time tested, 20 years, and it's widely accepted in India. Everybody in Dubai and Singapore and others are picking it up and practicing it. More than welcome to do it. We are fairly investigation agnostic. But if you're not getting results in the 2 week that we decided, then it's time to step back, look deep in, do an investigation, whether it's X-ray, sonography, MRI, you should get to the bottom of it. But if you have a diagnosis, then you have a therapy. If you're just blindly giving a treatment, so you can't paint the entire town with the same color,
Same color.
saying that this is what works. And that's why, correct. So we don't want a cookie cutter approach. We'd rather be more individualized to the PSRP as a deficit based approach. Okay, this person has a strength deficit, this person has a movement deficit, strength is good, then work accordingly. So it's a very modular program. Again, there's too much emphasis on pain relief, even amongst surgeons and within physios as well.
Yeah.
So I don't think that's the right, the priority is restoration of strength. So rather than work on resolution of pain, we'd rather work on restoration of function.
Okay.
And that is the best approach. So that's why read up, understand the biomechanics. It's intricate, it's complex, and keep introspecting, keep asking yourself, why is this not working? Very often, and this is true for every other thing that you do, whether it's your ankle joint, hip joint, backache, or whether it's addressing problems at home or at office, that too often we tend to see things in black and white. And we tend to give homogeneous answers to a heterogeneous problem. So best thing is in your early days, write down, these are the deficits, these are the pluses, these are the minuses, start working on them. And so if there's a poor core and there's a poor posture and there's a weak scapula, spend time doing that and then come to the PSRP proper and then move on. So a stepwise approach is important. Most generic treatments will work for majority of patients, but your metal is tested in those difficult complex patients like Mr. Saraf and Rohit. That's where you come to know, and that's important. And that's important, that we should be able to give them relief, restore them as best as we can, because that is what we are here for. And then we can always learn from each other, because you have a different difficult case which I have never seen before. Mansi has done some complex cases, she comes and discusses with me. So the education should just flow so that we are able to share all these things together. And that's why we've been at the helm of teaching right from day one. And so your effort on this time to bring us on this podium is very exaltatory, and we really appreciate that. Thank you for this opportunity.
Sure, sir. So basically, in one words, I would like to say it's not just about widening your knowledge base, it's about widening your perspective. Yeah.
Sure.
So moving on,
Sure.
sir, I would like to have a last comment from you on the eve of World Physiotherapy Day. What is the one message you would like to give all physiotherapy community? And what is the something, I don't know if you want something to change, if you want something to improve, or we are already there. I would just like to have the last comment from you, sir.
We are all there, Pirak. All the healthcare workers, from physios to surgeons to nurses, and in this COVID-19 situation, anybody who's dealing with health, in terms of even the receptionists, even the planners, even our ward boys, our drivers who are taking us there, the ambulance drivers. So there's a big, large laundry list of people. But the one common thing between the physios and our surgeons are we have one common goal, and it is mitigating pain. If we can do this in a robust manner by restoring them to their normalcy and in the shortest, cheapest possible time, then we've achieved what we wanted to do.
Sure. Thank you, sir. Thank you for those kind words. And I would like to wish all of my colleagues and everyone a happy World Physiotherapy Day. And let's hope you just continue the good work which you guys are already doing. And Sir Ashish Babhulkar, sir, I would just like to thank you for all the time which you have devoted, all the expertise which you could just squeeze down in those 60 minutes. I know there is a lot to learn, but whatever time you could spare for us, it was really nice having you with us and sharing your experiences, and along with my other physiotherapy colleagues who could actually add so much value to this program, and you could actually give us a new perspective of looking at things. So I would just like to thank all of you for your time, for your expertise, and thank you for being here and just guiding us so much on this topic. Thank you, everyone. Thank you.
Thank you,
Thank you.
Pratik.
Thank
My
you for
pleasure.
having us.
Privilege.
Thank you.
Thank you, Mr. Saraf. Thank you,
Thank you.
Rohit.
Thank you.
Thank you, everybody.
Thank you.
Take care. Good night and stay
Good night.
safe.